Hello, and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Our program today, we're going to be talking all about heart attacks, prevention, treatment, what's new, and joining us for this important discussion is board-certified interventional cardiologist B. Ramesh Reddy. Dr. Reddy, welcome back to Today's Health.
Thank you, Barb. Glad to be here.
Let's start with the basics. What's a heart attack?
Heart attack is a condition where there are 2 or 3 arteries that supply the heart, and whenever one of the arteries is blocked suddenly, that causes intense pain, discomfort, and damage to the heart. And this whole process is described as a heart attack.
And how common are heart attacks?
Fairly common. We have actually almost 6 million in the United States having heart attacks, or heart disease as such, I should say. But that's the commonest killer today in the United States and probably all over the world also.
Wow, and probably getting more and more common as more and more of us age.
Well, it is certainly a disease of the aging, but we are also seeing in younger individuals too, unfortunately.
Wow, who is most at risk then?
Typically, men over 45, women over 55, those with diabetes, heart disease, and high blood pressure, high cholesterol, those who have more of a sedentary lifestyle. These are the situations where they're more likely to happen. And one of the most important things is smoking is a big risk for heart attack.
So how can any of us, whether we're in a high-risk group or not, how can we lower our risk?
First thing I would do is quit smoking if you're a smoker. That's the first biggest benefit you can do. Now, if you have a family history of heart disease, you can't take that away, but there are other risk factors you could modify. Controlling your blood pressure, exercising regularly, 30 minutes a day, 5 days a week is what we prescribe as the ideal way of keeping yourself healthy. Quitting smoking and taking your medicines regularly if you're already on medications. And aspirin a day, if you have heart disease, would be a best way to prevent a second heart attack.
How important is it for people to get regular medical care and be screened and those kinds of things? How important is that?
No, first of all, if you have no risk factors, if you're perfectly healthy, I would recommend an evaluation by your regular family physician at or over 40 years of age to have a stress test, see what your baseline capacity is. Subsequently, depending on your clinical condition, you can follow up. Now, but if you have risk factors like diabetes, high blood pressure, family history, smoking, you're more at risk and you should probably be followed more closely.
That little red flag needs to go up that says...
Yes, I think paying a little more attention to your health, your condition, being more aware of it is the right way to approach your health. And that will automatically give you the clue to go and get yourself checked, have evaluated, and taken care of.
Let's talk a little bit about the symptoms of a heart attack. I know there's been a lot of talk about that in the last few years because it can be very different. Can you review those for us?
Heart attack can present in many different ways, but the commonest presentation is people always say, I have discomfort in my chest. I feel uncomfortable in my chest. That discomfort could be a heavy pressure, could be a severe pain that could sit there right in the chest, or you go to the jaw or to the left arm, makes you feel sweaty, nauseous, and these are the typical symptoms. But you can also have a mild variety of this, just having an uncomfortable feeling in the chest, as if somebody is sitting on it. You just can't shrug it off. That kind of feeling you can have. So any uncomfortable feeling in the chest should not be taken lightly. So that would be the first symptom of a heart attack.
Does it correlate that if you have just a little bit of pain, then you would have a very mild heart attack? Or how does pain and the severity of the heart attack correlate?
See, the intensity of pain is not directly related to the severity of the heart attack. So in other words, if you have a relatively smaller heart attack, you can still have a lot of pain. And the other way is also it's true. If you have a large heart attack, the pain may not be as intense as you would expect, but you could have a constant ache or a discomfort. So the intensity of pain doesn't automatically reflect the severity of heart attack. So that's something to remember. So any pain in the chest, you should seek attention. Obviously, those who have a lot of discomfort quickly seek help, and that's a blessing in a way.
Because if you have a lot of pain, then that's really going to get your attention.
It gets your attention and you seek attention, so it happens both ways.
So if you think that you might be having a heart attack, whether your symptoms are mild or severe, what should you do?
If you have symptoms and if you're at home having the symptoms, take an aspirin, call 911, open the front door and wait for the EMS so they'll come and take over the care from there. That would be the best case scenario for you to deal with it. Do not try to drive yourself to the emergency room.
So, I'll be the devil's advocate. I live really close and I can get in my car and get over there faster than EMS. What can the EMS do for you?
Couple of things. First of all, when you have a heart attack, it's not just the chest pain. There are some electrical disturbances in the heart. You could have a very rapid heartbeat that could make you pass out, and it could be fatal. So if you're driving, that's an additional risk. Now, if the EMS comes and gets you, they can see that because they immediately put an EKG on you, and if such a rhythm happens, they can shock you and save your life. So that's the advantage. Even if you're very close, to be able to be seen by an EMT and to be taken in that ACLS ambulance or even a fire truck is more advantageous than you driving yourself.
I don't think we can talk about this enough because I continue to hear people say, yeah, I drove myself to the hospital and I got yelled at.
Well, it's true. We see patients who drive themselves because their pain intensity is less. They are not sure if it's the heart. So that scenario, I can understand that. But if you have chest pain and if it brings enough to get your attention, I think you should call 911 and seek help. That's the best advice I can give you.
And even if it does turn out not to be a heart attack, it's still the safer route to go.
It's always safer. Let somebody else, an expert in the emergency room, decide, get an EKG, evaluate you, and let them make the call rather than you make a decision based on your symptoms.
Yeah, that we're all good at self-diagnosis, aren't we?
Yep.
All right. Well, we're going to take a break, and we'll be back and talk more about treatment for a heart attack.
Thank you.